come over for an interview, right? Candidate A and candidate B. Who will you choose for your front desk?
Candidate B.
Why?
Because
Because it has whiter teeth. But how about this? Same qualification. No? Why don't you choose A? Just because of the teeth is not nice, right? And you guys are doing business in dental. It is about teeth, right? So if you can change someone from this to this, do you think that you are helping them to do a better opportunity, to give them a better life, right? So as simple as just doing whitening, okay, you can change someone's life, right? So in aesthetic, in dental, what you can do for aesthetic, you can always do whitening. Okay, whitening is the most least invasive procedures. You don't cut, you don't add, you don't subtract, right? The other thing, besides whitening, you can also do composite veneering, you can also do porcelain veneering and braces. So these are the part of the aesthetic dental, right? Now, so in whitening background, we say it's one of the least invasive dental procedures because actually you don't really cut, you don't add, you don't subtract. All you do is apply the gel and remove the gel and you can change the tooth color, right? It's like 89% of these procedures completed by dental staff. We have few other products. Okay, we have the chairside, we also have the take-home kit, so you can always do these procedures in a very simple method, right? Well, this is based on the US statistic, but I believe in Nepal, everyone here always love to drink coffee, always love to drink tea. Whenever I sit down, people will ask me coffee or tea, right? So I think this is the main thing that you guys, the drinks that you guys always drink. And if everyone drink coffee, I believe everyone will have yellow teeth, okay? And beside that, I also think that there's a lot of smokers here. So there are the few people that is the target customer, target audience for whitening. Right? Now, what causes tooth discoloration? Okay, what makes our teeth yellow? Right? There are many factors, but most commonly is the food and the drink. Okay? Beside that, beside food and the drink that we daily consume is medications, alright, trauma, and also age factor. Right, so these also will contribute to your tooth discoloration. Okay, now up to now, you guys okay? Alright, let's go. Now there's only two types of stain. Okay, there's only two types of stain that that make your teeth yellow. The first is called extrinsic stain. Okay, extrinsic stain is what? This stain is mainly come from the food and the drinks. Okay, example, coffee, tea, curry, sambal, anything. Okay, everything that has coloring. Okay, even if you eat momos with the sauce, it also cause tooth discoloration. Okay, so this is whatever that we consume, the food and the drinks, we call it as a extrinsic stain. Okay, and beside that, the other one is called intrinsic stain. Okay. For intrinsic stain, what is intrinsic stain? Intrinsic stain meaning that internal stain. Okay, it's either you are born with it, genetic, okay, or drugs, which is normally some young kids, they need to take medications, antibiotics, that will also affect their tooth color. Right? And last but not least is the trauma. If they have accident, they bang on the tooth, they also will cause tooth discolored, and it's from inside. So we call it as an intrinsic stain. Okay, now, doesn't matter whether it's an extrinsic stain or intrinsic stain, both type of stain can be bleached. Okay, both sides also can be bleached. Meaning another way, there's nothing cannot be bleached. Right? Question is it safe or not? Okay, do you think doing bleaching is safe? Safe? Doing bleaching, do you think is it safe? Not safe?
ब्लिचिङ गर्दा सेन्सिटिभिटी हुन्छ भन्ने एउटा डर हुन्छ होइन अब हामीले मास्टर्स गरेर डेन्टिस्टहरूलाई पनि डर छ क्या त्यो as basically side effect duplicate गर्दैन sensitivity भनेको एक दिन त्यसको लागि मात्र त्यसले बल्बमा हार्म गर्ने यस्तो केही पनि गर्दैन ब्लिचिङ इज टोटली सेफ तर some procedure you have to follow.
Okay. So the question, do you think it's safe? Yes, right. So it is safe. Why? There's hundreds of studies by Dr. Haywood, Dr. Bruce Mattis, Dr. Jared Kruger. All of them has proved that there is no enamel reduction, there is no enamel softening, there is no alteration or damaging on the enamel. If your enamel is like this before whitening, after you do bleaching, it is also like this. No change. Okay? What does it change? What change? Color. Awesome. Okay, I'm asking because I want to know whether you guys get what I'm saying, right? Okay, so what changed is only the color, right? Now, but not everyone can do whitening. Okay, we have limitations. So, patient below 10 years old, we don't do whitening. Okay, kids 10 years old, no whitening. Pregnant woman, okay, no whitening. Nursery mom, no whitening as well. Those that have breastfeeding. Why? Because we don't have studies that prove it's safe within this type of patient. So we say, don't do it. After you deliver, only you do. After you finish nursing, only you do whitening. Right? Now, beside that, those who have crown, who have breach, who have filling, who have class 4, composite restoration, all these not going to work on them. They work on the rest of the tooth that is original, but not the crown, breach or restored teeth. Okay? Because that one you need to change the whole crown, or you need to remove the filling and then change the filling. We can't change the color of the filling. Alright? Besides that, those patients that have periodontal disease, okay, the gum is not so healthy, so they are not suitable to do whitening. Treat the gum first. Okay? Root surface does not responding well to the whitening, or anyone who does not who have allergy to hydrogen peroxide, which is rarely happen. Okay? So how does it work? Okay, we always ask, how does whitening work? Okay, they don't thin your enamel, they just change the color. How they change the color? So this, they are going to tell you how.
How does bleaching work? Tooth whitening is a chemical process. When the bleaching material touches the tooth, the carbamide and hydrogen peroxide freely pass through the enamel and dent, which permeate to all parts of the tooth. These peroxides break down into oxygen radicals, which then migrate between enamel prisms, breaking down any colored molecules that result in tooth discoloration, thereby making the internal tooth
Not sure if you can hear what they say, but okay, in conclusion, okay, let me tell you how it actually works. Now, this is your teeth, right? So why your teeth is discolored, got colored. Why? Because all the colored molecule all actually clustered together in front of the enamel. Okay, so when the lights go in, they reflect to your eyes. This is yellow, the stain, right? Now, what we do is we put hydrogen peroxide or carbamide peroxide gel on top of the enamel. Okay. Now, when it go on top of enamel, it will goes into the enamel. It will break down into water, oxygen, and free radicals. Okay. So these three things will break down the colored molecule strength. So what they do, they break down the colored molecule strength. Now, here is more space already, right? When the lights go in, they will go into the lentille and reflect to your eye. That is white color, because all the colored molecule now has been separated. Okay, so there is light can go in. Now, that is how it works. So if you have 1,000 colored molecule in the enamel, after you do whitening, it still maintain 1,000. But what they do is they split it up. So there's more space, light can go in and reflect to your eye, that is white. Alright? Now there's two types of whitening gel. Okay. Doesn't matter what company, doesn't matter where, doesn't matter how, there's only using two types of gel. Okay, which is hydrogen peroxide or carbamide peroxide. Okay, so what's the difference between hydrogen and carbamide? Hydrogen peroxide faster breakdown, okay, shorter wear time, right? Carbamide peroxide slower breakdown, longer wear time. Okay, now hydrogen peroxide is 3 times stronger, meaning that if you are using 10% of hydrogen peroxide, is equivalent to 30% of carbamide peroxide, 3 times stronger. If you are using 15% of hydrogen peroxide, is equivalent to 45% of carbamide peroxide. So sometimes when you see the products 35%, 45%, but you see whether it's hydrogen peroxide or carbamide peroxide. Okay, if 40% hydrogen peroxide is equivalent to 120% of carbamide peroxide. So that is very high. Okay. Now, which type of the gel used for what type of stain? Hydrogen peroxide, fast mechanism, is only used for yellow and brown stain. Normal yellow and brown stain. Okay. Carbamide peroxide is used for normal yellow and brown as well, but they are mainly target to the tough stain. Tough stain meaning that blue, grey, okay, tetracycline stain, okay, very dark brown stain or smoker stain, this all falls under carbamide peroxide. Right? So far, okay? Understand the concept? Right. Now, basically, that is how it works. Okay, that is what you're gonna use to do whitening, right? So welcome to the opalescence family. We have 5 categories, right? So what we provide, we will have this customized take-home kit whitening. You can do bleaching at home. Another one ready to go take-home kit whitening as well, bleaching at home. In office, which is doing at the chair side, whitening, specialty and aftercare, right? So we have 5 categories. The benefit of our gel, the benefit of using Ultradent whitening, which is opalescent, why you have to choose us? Number 1, all our gel is loaded with potassium nitrate and also fluoride. All. Okay, meaning that why we have potassium nitrate? Okay, potassium nitrate is to prevent sensitivity. Okay, and why we have fluoride? Fluoride is to strengthen the enamel. So, if people say you do whitening, you will weaken your enamel, you will thin your enamel, that is not true. Because all the gel, we actually loaded with fluoride to make it stronger. Okay? So all the gel will have P and F, potassium nitrate and fluoride. And all the take-home kit, okay, we have xylitol. Right? Xylitol, why we have xylitol? It helps to reduce caries-causing bacteria. Right? Now, beside all that, okay, the most important thing is our gel is at neutral pH. Okay? It's not acidic, it's not alkalic, okay, but it's neutral. Why we choose neutral? Because it will reduce again the caries-causing bacteria, and also it will prevent decalcification. To which, if it didn't prevent decalcification, again it will make your teeth weak. Right? So it will prevent decalcification, and the most important thing that we give 20% of extra water into all our gel. Okay? Why we give extra 20% of gel? Because it will prevent dehydration. When you do bleaching, you will have dehydration. Okay? So when you dehydrate, what will happen? What do you think will happen if your teeth is dehydrated? Sensitivity, right? So you will have sensitivity. So we give more water to prevent sensitivity and also to prevent relapse. If your teeth is dehydrated, you will get whiter shape. Okay, trust me. If you use a cheek retractor, you do a cheek retractor to your patient for 2 hours, it will become whiter. Okay, but when your patient drink, eat, dehydrate back, it will relapse. Alright? So when your teeth is dehydrated, it will become whiter. Okay? That is why we want to prevent the relapse, we give extra water. Alright? Now, let me introduce to you this product. And you guys, we're gonna try this product today. Last time we didn't try, right? No. Okay. So this time we'll let you try. How awesome is this product? Okay, this is Opalescence Go. Okay, Opalescence Go is a take-home kit. Right? Everything is prefabricated already. You do not need to do tray. You do not need to do anything. Okay, just get the patient to wear the tray for half an hour, 1 hour, or 1.5 hours, depend on the strength, and that's it. Okay, you will get a vital teeth. Right? So this treatment is a 10 days treatment. Okay, doing it at home. Alright, not doing it at the clinic, but doing it at home. But I heard from Pramod saying that the patient here compliance is not good. Meaning that you ask them to do it at home, they do it today, they don't do it tomorrow, they don't do it the next day, and then they do it again, and then they don't do it again. When the consistency is not there, you will never get the result. Okay? Sorry? Yeah. Sorry? If you don't do it every day, you need to do it every day. Yeah. Only you can get good result. If you do today, tomorrow don't do, the next day don't do, and do it again, you won't get the result. Okay? Because this is a take-home kit. So, what they say to me is, normally you will ask the patient to come to the clinic and do it every day in the clinic, at least 5 to 6 days. Right? Then you will get the result. Right? But again, it depends on how you teach the patient. If they buy the whole box, they do it at home, just make sure they do it. Okay? If they don't come to the clinic, you call them, do it today. It's only half an hour, right? And this is Opalescence Go. Now we have
ब्लिचिङ को उहाँले सुरुदेखि भन्नुभएको छ ब्लिचिङले जनरली दुई टाइपको ब्लिचिङ छ एउटा हाइड्रोजन पेरोक्साइड एउटा कार्बामाइड कार्बामाइड जनरली हामीले एज अ होम ब्लिच धेरै युज गर्छौँ हाइड्रोजन भन्ने चाहिँ स्टेटहरू चाहिँ क्लिनिङमा युज गर्न मिल्छ हामी चाहिँ ओप्लोसेन्ट युज गरेर 40% हाइड्रोजन पेरोक्साइड युज गर्छौँ त्यो चाहिँ चेयर साइड भयो यो गो भन्ने चाहिँ नि हाम्रो तिनवटा टाइपमा आउँछ एउटा 6%, 10% र 15%। यो सबै हाइड्रोजन अहिले बाँकी चाहिँ यसको मेन खासियत चाहिँ के हो यसमा तपाईँहरूले पेसेन्टको इम्प्रेसन लिनु पर्दैन, ट्रे बनाइरहनु पर्दैन, आफूले जेल हाल्नु पर्दैन। यसको भित्र आफूले नै पहिले जेल हुन्छ ब्लिचिङ जेल मात्र पेसेन्टलाई यो लगाउने टेक्निक सिकाएर अब यो ट्रे खास 10 दिन लगाउनुपर्छ। ओप्लोसेन्सको सेड आउनलाई 8 देखि 10 दिन चाहिँ लगाउनै पर्ने हुन्छ। गोमा एउटा फाइदा के छ भन्दा अब हजुरको एक त टाइम बच्छु क्लिनिकमा पेसेन्टलाई राखेर चेयरमा गराउनु परेन, मात्र इन्स्ट्रक्सन दिएर घरमा पठाउनु। अब गो 15% र 10% हामीले सेवा गर्छौँ। यो भनेको अलमोस्ट 10% भनेको 30% होम ब्लिच बराबर हुन्छ। 15% भनेको 45% कार्बामाइड पेरोक्साइड जति बराबर हुन्छ। यो आधा घन्टादेखि 1 घन्टा मात्र आएको अनि पेसेन्टले अब ओप्लोसेन्सको सेट देखिन चाहिँ 3 देखि 4 दिन लाग्छ। तपाईँले त्यही भएर उसले भन्नुहुन्छ कस्तो भने मैले आफूलाई ब्लिचिङ गर्दा पनि मैले बिचमा 1 दिन छोडेँ, बिचमा 1 दिन रियरली त्यो इफेक्ट पर्दैन। तर पेसेन्टलाई भन्नु पर्ने पेसेन्टले रेगुलर लाउँदैन। नेपालमा खास ब्लिच क्लब भएको कारण चाहिँ अब अलिक अहिले हाम्रो टेक्निसियनहरूले चाहिँ रेगुलर पेसेन्टले त्यही लेभलको अलि एजुकेटेड भएको भएर होला उनीहरूले अब एस्थेटिक्स वाइज अब विदेश विदेश घुम्ने मान्छेले रेगुलर गरिदिनु हो। अहिलेको न्यू जेनेरेसन मोडल्सहरू यङ अब केटाहरू मेन पेसेन्टले चाहिँ मिस नगरोस् 1 दिन भने अब घरमा लगेर त दिँदैन, तर पेसेन्टले मैले मिस त्यही भएर क्लिनिकल्ली अब त्यहाँ बसेर हरेक दिन पेसेन्टले आउनु भन्दा नि तपाईँ लाउँछ। तर पेसेन्टलाई एस्योर गर्नुहोस् कि रिसेप्सनबाट लाउनुहोस् भनेर चाहिँ भन्नुपर्छ। 4 दिन कन्टिन्यू लायो भने अलिकति सेट चेन्जेस आइसक्छ। यो बाहेक अब अरू अब जस्तै क्राउन ब्रिजको कुरा रहेछ, क्राउन ब्रिज अनि फिलिङ्स होइन तिनीहरूमा चाहिँ ब्लिचिङले असर गर्दैन। जस्तै हजुरको यो दाँतमा क्राउन छ भने अब अरू दाँतलाई व्हाइट बनाउनु छ भने अरू दाँत व्हाइटर हुँदै जान्छ तर यहाँ मिल्दैन। त्यही भएर एस्थेटिक्स गर्नु छ भने पेसेन्टलाई तपाईँले पहिला चाहिँ ब्लिच गर्नु। जस्तै अब उसको सर्भाइकल एभरेजन छ फिलिङ गर्नुपर्ने छ भने पहिला टेम्पोररी इन्स्ट्रुमेन्ट लाउनु अनि ब्लिचिङ गर्नु। ब्लिचिङ तपाईँलाई पुरो त्यो एउटा व्हाइटर के आएको यो भन्ने चाहिँ बल्ल त्यो जुन साइडको दाँत छ त्यो जुन जुन लेभल जुन सेडमा आयो त्यसपछि त्यो सेडको फिलिङ गर्नु एस्थेटिक्स र जनरली ग्राउन्ड फिलिङ्सहरूको चेन्ज गर्दैन ब्लिचिङ त्यो चाहिँ आफूले त्यो याद गर्नु पऱ्यो अनि मेन हेर्ने भने माइक्रो सर्भाइकल एभरेज र माइक्रो क्र्याक्स हो तिनीहरूले चाहिँ सेन्सिटिभिटी अलिकति गराउन सक्छ र प्रि र पोस्ट डिसेन्सिटाइजिङ बेस्ट
Just tell me poses. Just we're gonna do one by one. Anyone understand English? Put up the hand. 1, 2, and the rest? 3, 4, 5. Only 5, 6, 7. Okay, again. Understand English? Take up your right hand. Alright. Then why you need a translator? Okay. Just ask me if you don't understand. Why? Because I don't want, not to say Pramod don't understand. Pramod know all the products, okay? But I want to let you know by stage and stage and stage. So now we are talking this opalescence go take home kit. I haven't touched on sensitivity yet. I haven't touched on anything yet, okay? I will let you know about the sensitivity later part, alright? But now, opalescence go, okay? We have 6%, 10%, and 15%, right? 3 strength. Different strength, different wear time. Okay, 6%, 1.5 hours wear time. 10%, 1 hour wear time. 15%, half an hour wear time. Okay, now this is hydrogen peroxide. Okay, if you ask, will it cause sensitivity? Now it's all back to you guys. Before you do any whitening procedure, okay, before you do any whitening to the patient. First, you need to check the patient got sensitive or not. Ask them, when you drink cold water, sensitive or not? When you eat sour food, hot food, sensitive or not? If they say no, then you can proceed with whitening. If they say yes, then you need to treat sensitivity first. How to treat sensitive? We have this other product that treats sensitive, which is in aftercare, which I will tell you later. Alright? But if the patient said no problem, okay, no sensitive, start do whitening. Okay? As simple as this opalescence go. How to use this opalescence go? This is how it's gonna wear, and today we're gonna wear it now. Alright? After we finish 1 hour treatment, only you eat. Okay? I don't want to stop, so we try, then we finish it, then we eat. Alright? So everyone will have one piece to do only the upper arch. Okay? Alright. 10 pieces like this. One is for upper, one is for lower. Okay? It actually upper and lower feet doesn't matter. But when the patient use it, you just tell them U for upper, L for lower. Right? Yes. But now doesn't matter. It is actually similar.
Upper lower
Okay. Now I want everyone to do it on the upper. Okay, do it on the upper. Right? Okay. How to wear it? Now, when you open the pack, right? Now everyone open the pack. Don't do anything yet. Open, take it off. Right?
Side person. Side
Hold it like this. Okay, hold it like this. Right? Okay, everyone ready? Now, you center the arch. Okay. Now you can see there's a white tray inside, right? Okay. So make sure your arch is inside this white tray. Okay, so you center the arch, lift it up, put it inside the mouth. My upper is venient, so I'm going to do the Ramon, you do one also. Alright, so you center the arch, lift it up.
This is limbo, right? So, okay.
Okay, put it in, kiss 2 times with the sound. Don't push, okay, just kiss. Okay, or swallow. I don't hear the sound, kiss. Alright, after you kiss, remove the tray, leave the white tray in. Okay, everyone in? You can check the right side. So, see? Is right? Alright? You have it? Take one. Everyone have to try. She did implant. She did implant. Just the implant. When you are done, you do it. Okay. Alright? Everyone have it?
Yeah.
Okay. Now, this is 10%. Yes. Now, our body have hydrogen peroxide. Okay, everyone is in already, right? Okay, this one can throw. The tray, just throw it. It is disposable. Okay, so now this is 10%. 10%, 1 hour wear time. So now we start 11:30. You will finish at 12:30. Okay, now you will say, can I swallow? You have a lot of saliva, right? You have, right? Okay, don't worry. You can swallow. Okay, why we can swallow? Our body have hydrogen peroxide. Okay, so it's safe. And hydrogen peroxide, it will break down into water, oxygen, free radicals, and urea. Okay, so what urea do is, it will pass out. Okay, so it's safe. Any questions? Remember, don't push, don't bite. Don't push, don't bite. Why? When you push, you keep on push, what happened to the gel? You push, what happened to the gel? Come out, right? It will go up from the tray, right? Then you don't have whitening anymore. The gel has to be inside. So don't push. Okay? Why don't bite? Don't bite, why? You see the tray, right? If you bite, if they have a hole, what happens? The gel will come out again, right? So if the gel come out, there's no whitening effect. Alright? Now, later, even though with 1 tray, you will see a good result. Alright? Okay. Let me see. Braces one, U upper, L lower. Okay, then it will fit nicely. Will underneath the bracket be yellow? Do you think that it will become yellow, yellow, yellow? The white and then yellow dot, yellow spot?
Yeah.
Why? Because the bracket? You mean that the gel is not on the tooth? It's on the bracket. So, this one will become yellow and the rest will become white. Did you think that? Okay, that is wrong.
No. There is conflict. There is conflict.
No, it won't happen as well. Now, remember, hydrogen peroxide, when they break down into water, oxygen, free radicals. What free radicals do? They migrate. So the free radicals will go underneath the bracket. The gel already go into the enamel. So now the free radical go underneath the bracket, do the bleaching. So it won't have the yellow dot, yellow spot. Everything will become white after they remove the bracket. Okay? Alright. Now, after 10 minutes, after the tray inside the mouth for 10 minutes, it will form like an arch. So it won't be uncomfortable. You see, I can still speak. You also still can talk. This won't affect your speech. Okay? It is very comfortable. Alright? Now, we have this video to let dentists to promote, to let you guys to promote in the clinic. Okay? Why you need to do whitening and how you can do whitening. Patients can do whitening while they are cooking. Okay? They can do whitening while they are gym. They run, exercise. Doesn't matter. They can do whitening while you are sitting. You can do whitening while you are listening to lectures. While you stuck in the traffic jam, you can also do whitening. Okay? Anywhere, anytime, you can do whitening. So there is no way why we have a yellow teeth. So this is amazing. Okay, now I have cases from my doctors in India. Okay, I have this type of patient. You know what is that?
Scaling को काम नहीं करने रहता।
Pattern.
Tobacco.
Scaling करने रहने रखने ये करने से।
Do you have a lot of patients like this? You see a lot of patients like this? They come and do scaling, they come and do polish, but the stain won't go away, right? It will maintain like this, right? This is after scaling. Okay, after scaling, become like this. One piece of opalescence gold, 15%, half an hour.
जम्मा एकचोटि गरेको यही तर 15% यो 10% हो यो भन्दा 50%
1 hour में भयो।
आधा यो 1 घण्टा हो 15% आधा
हाफ आवरमा एकचोटि नै यस्तो हो
So,
स्केलिङ गरिसकेपछि
त्यो स्टेन मात्र
Scaling करना बच्चा नहीं ये करते भैया।
क्यालकुलस गर्दा स्केलिङै गर्नुपर्छ स्टेन चाहिँ क्यालकुलसलाई त स्केलिङै गर्नुपर्छ स्टेनको लागि मात्रै हो नि
तपाईहरुले यस्तो पेशेन्टले अफोर्ड गर्छ पैसा तिर्न सक्छ भने मेन यसको खास बाहिर चाहिँ के हो भन्दा स्केलिङ गर्छ नि स्केलिङ आफ्टर स्केलिङ अप्पर एउटा आर्च भएपछि पेशेन्टलाई डबल सेन्स बो लगाइदिने दोस्रो आस्क इट विल स्टे अनि आधा आफ्टर हाफ एन आवर अर 1 आवर विच कन्सन्ट्रेसन यु आर अप्लाइङ अनि उसलाई निकालेर देखाइदिने हैन इन मिरर
amazing?
Good.
Can you guys do it?
Yeah.
So after scaling, if your patient have this kind of stain, okay, you can do it. Just tell them to buy one piece. Okay? And if they're happy, now this is not white. Okay? If this is maybe A2, okay, it's not A1, it's not white. But what it does is remove all the stain. Okay? Or this.
स्केलिङ
यसमा चाहिँ एक चोट
Do you have this kind of patient? Scaling? They got stain here. After scaling, the stain won't remove, right? It will maintain there, right? One piece of opalescence gold, 15%, half an hour. All the stain is gone. The teeth is not really white. It's slightly whiter a bit. It's because only one tray. If they want super white, they want like this white, they need to wear 10 days. But what this opalescence gold do is, they remove this stain, you see? Will scaling remove the stain?
No.
So you need opalescence go to remove it. So you can do this package treatment, scaling plus stain remover, one piece opalescence go. And when the patient remove it, they happy? Will they be happy? Yes. And will they ask you, I want whiter? They will, right? Then you sell them the 9-piece balance. Okay? Alright? Simple. Right? Now this is opalescence go. Now this is another one. It's called opalescence PF. Okay? Opalescence PF is carbamide peroxide. Right? Opalescence go is hydrogen peroxide. So that's why shorter wear time, we're gonna wear only 1 hour. Okay? When we talk about opalescence PF, is carbamide peroxide, it is slower, wear longer. Okay? And this one is in the syringe type. Okay? The syringe look like this. And this one, you need to do a customized syringe. Okay? This is for what type of patient? Tough stain. Tetracycline, blue-gray, yes, smoker, okay, and if some stain is yellow, but they have the crooked teeth.
यस्तो हुन्छ अलाइनमेन्ट नमिलेको दाँतमा चाहिँ नि यसले काम गर्यो जिग्ज्याग हुन्छ नि दाँत तपाईँको जेल एक्ज्याग यो त पहिले प्रिफर्म यो भयो तपाईँले इम्प्रेसन लिएर ल्याबले बनाएको ट्रेमा चाहिँ जस्तो नमिलेको दाँतमा पनि त्यही अनुसार ट्रे बन्छ त्यसको लागि यो ब्लिचिङ बेस्ट
Okay, so you understand why we need to use this, because sometimes it's a crooked, you need to do the customized tray. Okay, do you guys do tray? You have the former? Or you send it to the lab? Okay. So, now, when we use opalescence PF, you need to wear a longer time, right? If the gel is watery, will it stay in the tray?
त्यो जेल एकदम झोलिलो भयो भने ट्रेनमा बस्दैन त्यही भएर अल्टरनेटले चाहिँ अलिकति लेदो टाइपमा बाक्लो
Remember, don't push, don't bite. Leave it like that. Okay?
I have to already
Now.
become sir. So I have very sensitive.
You have sensitive?
So
Try. Just try. If you have sensitive, remove it. But if you don't have, because we have a doctor who tried, he keep on saying I have sensitive, I have sensitive. We ask him to try. He wear it for 1 hour, no sensitive. Remember, we have what inside? Potassium nitrate and fluoride in the gel. So it will reduce the sensitivity. Have you tried?
I have already
ट्राई भनेको तपाईँले आफूले अल्टरनेटको चाहिँ कस्तो भने डक्टर ऱ्यान्डको सर हिमसेल्फ इज अ डेन्टिस्ट उसले के चाहन्छ भने हरेक कुरा टेक्निकल हुन्छ डक्टरलाई थाहा हुनु पऱ्यो हाउ टु टेस्ट होइन के हुन्छ पेसेन्टलाई यस्तो हुँदो रहेछ जस्तो तपाईँले नमिटी स्प्रे हान्दाखेरि हाया तपाईँले आफैलाई कहिले लाउनु भएको छैन तर टपिकल जेल वाटरमेरी बबल गम फ्लेभरको लाउँदा कति पेसेन्टलाई कति रिल्याक्स हुन्छ त्यस्तो हरेक कुरा ट्राई बिफोर यु आर डुइङ पेसेन्ट ट्राई अन इयर्स अल्टरनेट गरेर तपाईँले आफूलाई अहिले ट्रे लाउनु भयो भने तपाईँलाई यु क्यान नाउ फिल पेसेन्टले कस्तो होला पेसेन्टलाई अब लगाउने तरिका सबै तपाईँहरूलाई पनि थाहा हो नि त नत्र भने तपाईँलाई मैले ट्रे ल्याएर तपाईँले लाउँदा मिलेन तपाईँले नि प्रडक्ट पनि फ्लप हुन्छ त्यही भएर उनीहरूले अल्टरनेटको एउटा किनभने डेन्टिस्टकै कम्पनी भएको भएर उसले हरेक प्रोसिड्युर चाहिँ पहिला डक्टरले आफूले गरोस् अनि उसलाई थाहा होस् र मात्र पेसेन्टमा आफूलाई हेर्नुहोस् त्यो हो त्यही भएर तपाईँहरूलाई गराएको त्यो संसारभरि नै गर्नुहोस् तपाईँले झन् फ्रीमा दाँत हेर 600को ट्रे पाइरहनु
Right? So why we want to have this so sticky? So that the gel will stay on your teeth. Then it can do the whitening. If the gel all over, it won't do the whitening for you. Okay? So same on PF. Our gel is very viscose. Okay? I can show you this. This is other brand. You see? The rest is very watery. Opalescence stay nicely. You see the rest? So, the viscosity of the gel is important so that it stays long your soft ring will be stuck there. Okay? Opalescence PF, we have 4 strands. How many strands you sell here? Everything. Everything. Okay? 4 strands. 10%, 15%, 20%, 35%. The difference is wear time. 10%, 8 to 10 hours. Okay? 15%, 4 to 6 hours. Wear. 20%, 2 to 4 hours. 35%, half an hour. Okay? So, if you use 10%, you do it at night, overnight, sleep while whitening. Okay? And if you have sensitivity, you can go for 10%. Because the lower concentration, the lower sensitivity. Okay? So if you wear opalescence gold, you need to wear 6% if you think that you have sensitivity. But I can guarantee you, you wear 10%, no problem.
यो 10% भनेको चाहिँ अलमोस्ट 3.3% हाइड्रोजन पेरोक्साइड भयो यो अहिलेको टेम अहिले तपाईँलाई वाट 10% हाइड्रोजन थियो नि त्यो भनेको 40% भयो त्यही भएर तपाईँलाई सेन्सिटिभिटी भयो तपाईँले लो कन्सन्ट्रेसन गर्नुपर्छ.
Alright? So the result of using PF, this type of patient, you think do they have hope? Normally doctor will tell them do veneer, right? But before veneer, you can do whitening. You don't need to do veneer. You don't need to do filling. You don't need to do composite for that. Just let them do a tray, give them 10% or 15%, wear it overnight for 2 to 3 months time, every night. This is the result. Okay? So whitening is amazing. Alright? Or this type of stain. If you have patients like this type of stain, you tell them to do veneer, right? Composite. But even if you want to do composite, it's so grey. You need to mask. And sometimes your mask will make it become very thick. So the best way is do whitening first. Then only you do filling if they want. But if like this patient, this is the after result, 2 months. Do you think the patient want to do veneer? No need. Because it's so white already. Okay? Normal say 5 nights. Why they need to do PF? They can use opalescence gold, right? Because this is yellow only. But why they need to do PF? Because of the crooked teeth. Alright? This is also, okay, normal yellow, 10%. Now, I'm not going to play this. So, for PF, you need to do customized trade. So normally you take impression, you do the stone cast, you send to the lab, right? So when you send to the lab, make sure they do this block out. Okay? If you have blue-gray stain, 2 to 4 weeks time. Smoker, 1 to 3 months time. Tetracycline, 1 to 12 months time. Average, 3 to 4 months. Okay? So, you guys understand? All good? Any question? Okay. Any questions? All good, right? Okay. So, besides take home kit, what else that we have? We have one chair side. Okay. If you do it in the clinic, this is opalescent boost. This is 40% hydrogen peroxide. Okay. This is very, very high concentration. Alright. For chair side, 1 hour power bleach. Okay. So this 40%, it is chemical activated. Okay. You don't need to put light. It's nothing. It's just chemical activate. Okay. Once you activate, you apply to the tooth. Alright. The step of doing it is
Do not use water while suctioning gel. When no gel is visible, lightly rinse and air dry. Use caution not to dislodge
After you
the
suck it
oxidation
out,
barrier.
don't rinse first.
Tip: clear suction periodically
Right?
with water.
Don't rinse because if you rinse, you will
Evaluate shape
dislodge
change
the
after each
opal dam.
application and monitor patients for sensitivity and irritation. If persistent
So
tooth
if you got sensitivity,
occurs, discontinue
Then you stop doing it.
Repeat application
You
1 to 2
apply the
times, or
desensitizer.
until the
But if
desired
no
results are
sensitivity,
achieved.
apply for
We do
another
not
round.
recommend exceeding 3 applications per visit. Suction
Maximum
gel from
is
teeth
3
using
times
lower back
of 20
adapter,
minutes.
surgical suction tip, then thoroughly rinse teeth with an air or
So
water
after the second time, happy already, then you stop. If it's not happy, what you do at the third time. And
Once
after
the
you finish
desired shape
everything,
of white
rinse
is achieved, or you have completed 3
and remove the opal
applications,
dam.
use a dental instrument to remove the cured Ultradent resin barrier. Whitening effect may continue for 24 to 48 hours following whitening, so a slight increase in whitening may be realized during this period.
So all very clear? Very easy, right? First, you need to mix it. Okay, so how to mix it? Push the white wine first plunger, push it in, then push it again, all the way go into the red wine. Then you mix left, right, 50 times. Once you mix properly, it will become red. If you don't mix properly, it becomes white. If it's become white, can you do whitening? Yes, you can, but the chances of sensitivity is higher because the P and F is not activated. Once it becomes red, P and F is activated, potassium nitrate and chloride is activated, it will reduce the sensitivity. Okay? So once you do that, then again remember isolation is important. Then you put the opal dam. Opal dam is how thick? Is 1.5 to 2 mm thick. Okay? And between 0.5 mm from the enamel. So this is the enamel, this is your gum. 0.5 mm from the enamel, you apply the opal dam, and then on top of it is about 1.5 to 2 mm thickness. Okay, pull it up, like cure it. Then you apply the gel. Okay. Now, apply again second time, leave it for 20 minutes, then you suck up, evaluate the shade. If you're happy with the shade, then you stop. If you're not happy, you can do one more time, 20 minutes, suck up, maximum 3 application per treatment. Okay? After finish, you suck up, rinse, remove the opal dam, and then you take the shade. So this is the before and after. Okay, before and after, 2 sessions. Okay, before and after. Okay, this one is called upper lustre. What is upper lustre? Upper lustre is a abrasion slurry. Okay, it's a silicon carbide particle. Okay, for you to remove a very thin layer of the enamel. Okay, and it comes with a 6.6% of hydrochloric acid. Okay, it is meant for what type of stain? It's meant for this type of stain. Okay, let me show this. Stain, which is like this. Patient like this. If you do whitening, this will be white. This one, you stay. Okay. So for this case, no PF boost, no remove. Only this. Okay. And fluorescence stain. You see a lot? White spot, fluorescence. You can also do that. This is fluorescence, and they remove the fluorescence and they do whitening. So that is why it become white. Okay. How to do this?
Is for professional use only. Before beginning the procedure, determine and record a baseline shade. It is also recommended to take photographs for patient records. Because of the hydrochloric acid contained in opal luster, Isolation is extremely important. Also, both you and your patient should wear protective eyewear. For additional patient comfort, apply a lip emollient prior to treatment. Apply the rubber dam attaching to the frame and inverting the dam at the gingival border. For additional protection, use Oracil caulking to prevent tissue damage. Simply peel back the rubber dam to expose the tissue. Express a small amount on a pad first to check flow, then express a thin ribbon of Oracil caulking beneath the rubber dam, along the gingival margin to prevent leakage. Reattach the rubber dam to the frame and reinvert the rubber dam where needed. Alternatively, a light-cured resin barrier such as Ultradent can also be placed at the gingival margin prior to the procedure to prevent tissue damage. When using Ultradent, express the resin to build a 2 mm strip along the gingival margins, extending about 0.5 mm onto the enamel. Extend the resin beyond the last tube to be treated. Where open embrasures exist, express resin through the opening onto the lingual gingival tissue. This will protect interdental papilla and lingual gingival tissue, as well as add retention to the Ultradent. Light cure the resin barrier using a pass-by cure. Take care to keep the light moving over soft tissues. Check the line access of each tooth for voids and add barrier if necessary. When applying Opoluster, remove the lower lock cap from the Opoluster syringe and securely attach the white MAC tip. Verify flow prior to intraoral placement. Apply approximately 1 mm thick layer over the discolored area. Using a rubber prophy cup at a slow RPM, apply medium to heavy pressure for 60 seconds at a time. Suction the paste from the teeth first, then rinse. Evaluate and repeat as necessary. Reapplication can be conservative and limited to the areas requiring additional treatment. After the final rinse, remove the rubber dam and sealer from the teeth, then
So
rinse
this is a
thoroughly.
very amazing
Apply
result.
a neutral sodium
Okay.
fluoride gel to the enamel.
Relief and also to maintain the shape. Okay, after you do whitening, the question is, how long does it last? Right? How long you think does it last? How long is the whitening does last? How long? You think? After you do whitening, how long will it last? 6 months? 3 months? 1 year? Now, if it's only 3 months, will the patient do? Will you do? No. It can last at least 1 year. At least 1 year. Okay? But again, it depends on the lifestyle. If you do whitening already, you every day 1 pack of cigarette, 5 cups of coffee, you think can last 1 year? So to make sure it can last longer, you need to do maintenance. So how to do maintenance? Number 1, you can go for toothpaste. Number 2, you can use Opalescence Gold every month 1 time. Every month wear 1 time. Pramod, he has done whitening 10 years ago. And every year, now let them see your teeth. Oh, not yet. Now, later you see his teeth. Every year, he only do 1 time once a year. Every time you have the whitening lecture, he will wear. Okay? So when you wear, it's to maintain. He don't smoke. He drink coffee, but he not really smoke. So the stain goes so fast. Okay, the whitening lasts longer. Now, how many will whitening affect the enamel? Will the whitening make your enamel weak? Will bleaching make your enamel weak? Will bleaching harm your enamel? Yes? No. No. Why? Because we have potassium nitrate and also fluoride inside the gel. So it won't harm your enamel. How many shades will my teeth whiten? How many shades? 3? 3? 2 to 3? But if you tell patient 2 to 3 shades, they do? Will they do whitening? Just so little. And so much I need to pay. They don't do, right? Normally it's 7 to 10 shade. 7 to 10 shade. Whiter. Okay, how? Now, this is whiter shade,
लाइट
right?
रेट तो इम्पोर्टेड है तपाईँले क्लिनिकल मार्केटिङ हो सेम लाइट
Okay. This is whiter shade. Right? Everyone knows this, right? A1, A2, A3, A3.5. I last time A3.5. Now is A1. How many shades? 1, 2, 3. But I say 10 shade, right? I say attempt to 10 shade, right? Okay. Patient don't know vita shade. You know, I know, don't know. Okay? What they know? Chroma shade. Rearrange your vita shade guide. Whiter to the darkest.
तपाईले जहिले पनि सेट गाइडलाई यसरी एरेन्ज गर्नुपर्छ राइटर देखि डार्केस्ट
So this is important. Take a
पेशेन्टलाई यो
picture.
देखाउने कति चेन्ज भयो भने उसले रियलाइज गर्छ उसले तिर्नु पर्छ
Change your shade. Rearrange your shade. Now,
यो कुनै पनि
A3.5
कम्प्युटरमा यही डाक्टर सुशील गरेलाले गर्ने
so last time I am A3.5. Now I become A1, right? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So is it correct? 10 shades? So if you tell your patient 10 shade, will they pay and do whitening? Yes. Okay? So this is all about the whitening. Okay, now I've noticed you guys take videos. You saw all the videos, right? All the videos can be searched at YouTube. Okay? YouTube channel, type Ultradent product.